Hello and welcome to Nursing 516. My name is Dr. Bill Diehl-Jones. I'm a professor in the Faculty of Health Disciplines, and I am both the coordinator for Nursing 516 and Nursing 517, as well as an instructor in 516. So what that means is I coordinate the activities across all 6 sections of this course. Each section has a group of students, anywhere from 15 to 20, and there's one instructor associated with each group. So my job is to basically teach my own section as well as coordinate the activities of all the others. So you'll be hearing lots from me this term, but your first go-to person for the course is your instructor. There are activities which will occur strictly within your section of the course with your instructor, as well as there are a few group activities where you'll be able to meet and interact with different students from different sections. So what I'd like to do today is walk through with you basically how the course works and orient you to the Moodle model. If this is your first time with online learning, never fear, most people take to it very, very well. So let's have a look at the Moodle page, and I'm going to scroll around here. Mine looks a little different from yours because I'm the course coordinator. But there are essentially 4 sections to the Moodle page, and I'll just scroll through those. First is the communication section. Next is the study guide. Following that is the assessment tab, and then there's a reference section at the bottom. So let's go up to the first part of the Moodle page, and you'll see different tabs. The box on the left of the page you can minimize by clicking on the menu or maximizing, and it'll take you to different parts of the course. So we'll start first of all with the top, and the top is the course mail. The course mail is used for you to communicate to your instructors, and your instructors will, if needed, send you individual emails via course mail. So please make sure you only use that to communicate with your instructors. Next is the news forum, and if you click on that, you'll see announcements posted by your instructor. And I encourage everybody to please check the news forum a couple times a week at least. Following that, there's a live chat module which you can use either with the instructor or between other students in the section, as well as different forums. And the first forum is the coffee room. Now, this is a room for you to informally chat with other students. Generally, the instructors do not go into the coffee room. So what we request is that everybody please observe polite communication and behavior, and at all times please be respectful with your fellow students. And I normally don't have to say anything about that, but it's a good place to start. Following that is the introduction forum, and by clicking on it you can post an introduction to yourself. And that's your first goal really in this week. There are 2 goals in week 1. One is to post a little introduction to yourself, who you are, where you're living and practicing, and perhaps something you wouldn't necessarily put in a resume. I will be posting one of those as well for my own section. And then following that are communication forums for each of the 10 learning modules in this course. So learning modules or units. So Unit 1 is Foundations, that's what happens in Week 1. Unit 2 is Pharmacologic Principles. Week 3, Foundations of Pathophysiology, and so on. And this is the place where students will be posting their case studies and where you will have an opportunity to interact and comment on the case studies. Now, below that, there are different groups which will be set up. Here I'm just showing you Dr. Jeffrey's group. He set up different PBL groups. So PBLs are exercises you'll be doing weekly, with the exception of week 1. We try to start you off slowly. And what happens there is you will be communicating within your assigned group. You'll be assigned a PBL group, and that's your forum for discussing who's doing what and maybe coordinating your activities. Now we'll move down to the study guide, and the study guide is where the rubber hits the road. You have access to your 2 e-texts here. You don't get paper copies, you have e-texts, and you have both the pathophysiology and the pharmacology texts. And there's a help desk if you're not sure about e-texts. And then finally, we get into the meat of the course itself. So the first tab is the introduction tab, so I'll click on that. And the introduction tab essentially gives you an overview of the course. It talks about the learning outcomes that you should expect after this course. What are the course materials that you'll have access to? We also make some suggestions about mobile apps. You can get a very useful mobile app called RxTX. It's a Canadian Pharmacists Association app that provides up-to-date drug information. And then we'll talk about course structure. So the structure is really organized around 5 different activities. First, I have already mentioned, are the problem-based learning activities. And this is done as a group. You'll be assigned this week into your PBL groups, and you'll be responsible for completing all of the questions as a group and submitting one document through the Dropbox, which I'll show you shortly. So it's complete in small groups, and your instructors will facilitate that. They'll look at your PBLs and give you some guidance. Second are the student-led case studies. Each student gets one case assigned by your instructor this term, and there are very specific rubrics which I encourage you to follow, which give you some guidance about what these case studies look like. And I'll be posting, all of your instructors will be posting an exemplar of what a case should look like. Then there are instructor-led case studies. So you'll hear from each of us about specific case studies. I'll be doing one on dermatitis, for example, and the dates for these are all listed in the course schedule or the course calendar that is posted in the news forum. And you will be required to attend any 2. I encourage you to attend all of them, and this is a synchronous case study done on Microsoft Teams, which means it's real time. You log in, and your instructor will walk you through a case and ask that you participate. Then there are 3-unit tests, and these are multiple choice tests, and there's approximately one every 3 weeks, and we increase the value of each test and the number of questions for each test as we go along. So for example, test 1 will have 40 questions, 90 seconds per question. Test 2 has 50 questions, again 90 seconds per question, and test 3 is at the end, and that has a total of 60 questions, and again you have 90 seconds per question to complete these multiple line tests, which are done online. And you have a week to do these tests, and they open on a specific date. Again, I've indicated these in the course calendar or course schedule, and this is done independently. It's not open book, and the last test is proctored. So we use an online proctoring service for test 3, and there's some information on that in the course schedule, which I ask that you all please read. So what are the tests based on? They're based on the learning objectives, which are at the beginning of each unit, the PBLs, the course videos, and the case studies. So if you study those, you should be in good shape. And then finally, there may be some review, well, there will be some review sessions. So what I do as course coordinator is before each test opens, I have an online synchronous review, and I'll post a link for all of that, again done through Microsoft Teams. You log in, and I do a review. I don't give you the questions, but I try to focus you on some of the important areas. All right. Following that are some guidelines for conference participation, and that includes problem-based learning units and case studies and so on. So it gives you some more information about PBLs. Also gives you some information about student-led case studies, and there are very specific points that we ask you to cover, beginning with differential diagnoses, explanation of the pathophysiology, and so on. And each one concludes with a script that you write for your patient in the case study. You may use narrated PowerPoints. That's not an expectation. The problem is often if you don't know how to compress audio files, we can get overly long or large files for your PowerPoint case studies. What I encourage people to do is to use the speaker notes for more detail, and again, we'll give you some guidance on that. The first case studies aren't due until week 4, and then throughout the rest of the term. We give you some guidance on references here about how to reference properly, and this is very important. You must use up-to-date primary references typically. Sometimes you can use secondary references such as textbooks, and there's more information on that. So this gives you a list of some of the case studies for each unit, and this is a marking rubric for your case studies, and we very specifically assign points for different components. For example, you get a possible of 1 point for 4 to 5 differential diagnoses with a rationale. And so if you don't address each one of these, then of course we can't award marks for that. We're also expecting that each student will participate in the case study forums and contribute to other students' case studies as well as your own. So what we want you to do is speak to some of the points raised in case studies. We don't expect necessarily that you're involved in every case study, but most case studies we expect you to say something, and you're awarded a mark for that. This again mentions a little bit more of your tests, and an important thing about your tests to note is that an overall weighted average of 70% is required for passing. In fact, for passing the course, we require a 70% in each of the separate components. Okay, so this is a little bit about the course itself, a little bit of an overview. Why don't we go back and let's see, I'm just going to take us back to another part here of the course, and let's have a look first of all at, in the study guide, a unit. So I'm going to go to Unit 4, which is dermatology. And that's when some of the case studies become due. So again, with each unit, you'll see learning objectives, learning resources, a little bit of background information, and so on. So if you go down through here, we talk about learning outcomes, and we include a little bit on antimicrobial therapy. In this first unit, you'll learn a whole lot more over the term about antimicrobial therapy. And then we cover bacterial, fungal, viral infections of the skin. And we're going to focus especially on dermatitis. Now, the text chapters here are listed for you. One thing I tell students is you must consider the text as a resource, not as a document that you have to read, learn, and inwardly digest. Okay? We want you to use it to look stuff up, and we direct you to the specific units. Same for the pharmacology text, or Cangelo and Peterson. Now, a really important point here is when you are making drug choices for your own case or for PBLs, you must use Canadian clinical practice guidelines where possible, and they must be current. We do not accept therapeutic choices made based on the textbook. The textbook is a place to start, but it's American, it's older. We need you to look for current Canadian clinical practice guidelines. In each unit, you'll find some videos. The videos are being overhauled briefly, but the videos are to give you an overview. So, for example, if you click on the link here, it'll take you to a video I've made on the histophysiology of skin. And then as we go through the learning it, you'll see a little bit of an introduction. We give you an overview on antibiotics. Then we get right into bacterial skin infections. And here's where you see a typical problem-based learning activity listed. And for example, there are four in this particular question, four things to answer. We expect succinct. We don't expect pages and pages. No more than, well, my guideline is 300 words per specific question. Must be specific and succinct. Again, citing primary literature. Wikipedia is not considered primary literature. So this question, for example, identify clinical resources appropriate for Canadian antibiotic prescribers. Okay. And then we get into fungal infections of the skin and so on. And you'll see PBLs associated. And PBLs are done as a group. There are different assigned case studies. We may not go through all the case studies, but there are usually B1 on dermatitis, maybe cellulitis, herpes, zoster, acne, psoriasis, as an example. So that is an example of a specific study guide unit. Let's go down to assessment here. Assessment is where you will deposit your PBLs and your case studies. You don't have to think too much about your case discussion contributor here. It's the case study and the PBLs where you upload so that your instructor can see them and can provide feedback. And then here you'll see the tests listed. So when test 1 opens, for example, you click on that and basically you're dropped into the test. All right. So this covers most of the essential points I wanted to raise today with your introduction to Nursing 516. Again, it may seem a little overwhelming. However, your instructor and I are here to guide you through this, and you'll find, I think, in fairly short order, stuff will start to make sense. So, welcome again, and I'll look forward to learning with all of you this term. Take care. Bye for now.